This is a very popular bariatric or weight loss procedure at the moment. It is becoming increasingly popular around the world. Here at Advanced Surgical, we perform about 70% of our procedures are sleeve gastrectomy. The reason it is so utilised and popular is it's very predictable. We pretty much know what's going to happen when someone is very overweight and comes in for a sleeve gastrectomy. It is a permanent procedure, it's not reversible. What we're doing with a sleeve gastrectomy is via keyhole incisions, usually 5, we are removing 3/4 of the stomach, literally taking this part out. And patients lose weight because they eat small, and also they really don't feel that hungry because this part of the stomach, the piece we've removed, makes all the hunger hormones. Patients are usually in hospital for 2 or 3 days, and they'll then go on to usually lose about 70% of their excess weight over a year. If they're a diabetic, they're usually in remission. It's very good for hypertension, it's very good for sleep apnea, it's very good for patients who are troubled with arthritis. The good things about sleeve gastrectomy are patients generally have good quality eating and very predictable and good weight loss. The downsides, or the risks of the procedure, there are really 3 things. The most important thing that patients need to understand, there's a small risk of a leak from the staple line we've just created. That would be a very big deal for a patient if it were to occur. It usually occurs in the first couple of weeks, and it can be a very significant complication because the stomach is a high pressure system, and if there is a small defect in the staple line, the acid in the stomach will come out. Patients usually will need drains and feeding tubes and multiple procedures via surgery or via endoscopy to fix this up, and it could involve a prolonged period of hospitalisation. The other issue with sleeve gastrectomy is that if patients were snacking long term after the surgery, they may have some weight regain, and we've certainly seen that after 5 years and sometimes before. Nutritional problems are fairly rare with a sleeve gastrectomy, but if a patient's starting off with a nutritional problem such as low iron or low vitamin B12 before surgery, this may persist afterwards. Generally, we would advise patients to have 5 years of multivitamins after surgery. I hope that's provided some information about sleeve gastrectomy, and we look forward to meeting you at Advanced Surgical.